One of the big trends that we have been seeing at HIMSS22 is remote patient monitoring, and I'm thrilled to be at a booth at Glooko, which is a company who's doing it extremely well. And we're going to talk to two people who work there, Kevin Brubaker and Kren. Kevin, let's start with you.
Sure.
What exactly does Glooko do?
So what we have is an app that patients can download, and what we're showing right away is just how simple it is and easy for patients with chronic diseases to manage their diabetes and other comorbid conditions in one place. Through here you can add things like A1C, the food they've had, the insulin, their weight, and that type of thing, and it makes it super easy for them to manage their diabetes, which promotes better outcomes from them being able to get everything in one place.
Great. Derek, let's talk to you for a second. So explain to me Glooko's approach for a better experience for the providers who are actually treating the patients.
Kevin mentioned how easy it was for the patients to include their data and to add it. So on the provider side, it's just as easy for the provider to access the patient's information and share it with the clinical care teams. So the
which by the way is huge, because so many people are talking about how much data you can have, and that all is great, unless it's not great unless you can access it really well.
Not only access it, but also use it. So we make it easy for the providers to write it to the patient's EHR record.
That's amazing.
It really promotes less chart chasing. It gets the information in the right place for cross-care team coordination, not just for the Diabetes Endocrinology Center, where a lot of this data is really traditionally kind of siloed, but it breaks that down so the PCPs, the endocrinology departments, the pharmacy all can get the same data that they've been missing before.
Yeah. It seems, people are always putting together technology that they hope will work, and what I love about this one is it's empowering both the patient and the provider to feel better.
It is, and I might also add that it aligns the patients, the providers, and also the health plans. So the diabetes management, chronic care management teams on the health plan, they all share the same data sets, so they're all working towards those quality and clinical outcomes.
Yeah, and one other thing too, it sounds like the payers are getting involved, which is huge. Can you tell us about that?
Yeah, to some degree, with what the payers are doing, they want to align what their scores are, right? And with quality care metrics, everyone's moving towards quality care, ACO-based payment systems, and having the data from the biometric devices is huge to back up their quality care to show the improved patient outcomes.
And actually get them to reimburse it and feel like it is worth them doing that.
Exactly. So much of the reimbursement is tied to your plan of care documentation. So we make it easy for the providers to create their care plans and then share them with the plan. And of course, if you're at risk, it all rolls up to CMS.
Yeah, exactly. You guys have an amazing conference. You guys are going to have a lot of conversations, clearly.
Thank you so much.
And I wish you luck.
Thank you.